Hello, everyone. Welcome back to the Thrive with Kate podcast. I'm here with Dr. Toni Engram, and we're going to talk about biological dentistry. So, for those who don't know anything about biological dentistry, and I just would love for you to give a bit of an overview on like who you are, how you got into it. I'm going to point people towards your website, which is flourishdental.com. But yeah, Toni, just start with telling us about how biological dentistry is different than what most people are getting at their regular dentist.
Yeah, so really, biological dentistry is borrowing the concepts of biological medicine, which talk all about terrain theory of disease. So instead of just going with germ theory, which is most of Western medicine, is one germ causes one illness or one substance can then cure said illness. Terrain theory is really looking at the health of the entire body. Like, how healthy is the terrain? Is it susceptible to illness or is it resistant to illness? And so what are we doing in dentistry? What are we doing in our mouths to either promote wellness or to promote disease? So that's kind of the high level definition of it. Now, how we actually look different in practice is we focus a lot on prevention and nutrition. We are avoiding toxins wherever possible. So I don't have any fluoride in my office. Those old silver fillings that most of us got when we were kids, that are half mercury, we're very, very careful with how we remove those because there is the potential for that huge mercury exposure in the process. We're taking an extra careful look at things like root canals and cavitations, things where these hidden infections that might not have been appreciated in the past.
Yeah. I just going into terrain theory versus germ theory, I think COVID was such a wake-up call for, I think, a lot of the holistic practitioners who have been writing, preaching on terrain theory for a long time, and just to kind of have that wiped out by censorship and mainstream or legacy media was, like, to me, just like insanely eye-opening to how much like our culture is super bought into germ theory, and COVID really, I think, hit the nail on the coffin with that one. So I'm just kind of curious, like, what were your reactions to what was going on in the media at that time with terrain theory? I'm just so curious.
It was an interesting time in many of our lives. I had actually, it was really a career pivot in the process anyway, because I had sold my first practice in 2019. Early 2019, and the goal was to get open and get, like, part of, I was burnt out. I was working in the insurance system, like I was in network with all of these PPOs, so just spinning my wheels, and really wanted to I just wanted a clean slate. And so my intention was to open a completely biological practice that didn't have my hands tied behind my back with insurance, and was supposed to get that open by the end of 2019. But then we had delays with the landlord, delays with construction, and then COVID hit, which obviously delayed things more. But it was really, it was interesting in that, just from a business standpoint, I got a slower start to the actual business than I wanted to, than I intended. Really solidified and forced me to solidify my values. And man, those patients that I got those first couple of years were like, those are my people, because they came specifically because we shared values. And it was, we were one of the few places where I wasn't going to make a patient wear a mask. We were very intentional with our vaccine policy when those came out. So it was a very interesting time. And I attracted a lot of the medical freedom crowd during that time, because that was what I believed. I think just in general, biological dentistry was actually set up better than a lot of our colleagues for COVID. Back in the early days of COVID, when it was like this scary respiratory illness that we didn't know much about, biological dentists were already set up to handle that, because we've been dealing with mercury appropriately for years before that. And so we had, well thought out filtration systems, using ozone everywhere, these disinfectants that were not quite as caustic as some of the other disinfectants. So really biological dentistry was set up well for like the scary parts of COVID, but also like just distilled the patient base into just this tribe of people who believed in overall wellness and medical freedom and freedom of information and informed consent, and bodily autonomy and all of these things. Like that's just, it was an interesting, but overall a really good, I think, growth process for all of us.
Yeah. So let's talk about the mouth. Let's just talk about the mouth and teeth and all of the pathways. I know different systems of medicine have different ways of mapping the physiology in terms of understanding whatever we want to call meridians or energetic channels or nadis in shrotas and the Ayurveda landscape. Like, what is going on with the mouth, and how does biological dentistry see the mouth in these pathways, maybe different than what people's traditional dentists are taught?
Well, it really is trying to blend these Western medicine concepts with the Eastern medicine concepts as well. Because in Western medicine, like if we look at the peer-reviewed research, we really are starting to see these tight connections between oral health and overall health. So we know that oral health issues are related to or correlated with things like heart disease, type 2 diabetes, basically any inflammatory condition, autoimmune conditions. But in Eastern medicine, it's more specific than that, where each tooth in the mouth is connected energetically to different organs and different systems in the body. So we're really trying to mesh the two worlds, because I'm still a Western medicine trained dentist. We're still practicing standards of care, but sometimes the standard of care, like our diagnostic methods, sometimes they don't give us clear answers. And so we're able to then bring in these Eastern medicine concepts and say, okay, I may not see what I'm expecting to see on an x-ray or on a scan or clinically, but if we look at the Eastern medicine, if we look at the meridians, then maybe we can see some better answers, or even, more holistic methods like thermography, just things that are adjuncts to our clinical diagnostics already that help give us much clearer answers and a more holistic approach to dental care.
Can you give an example just for someone that maybe doesn't really know what we're talking about, like how you might look in someone's mouth and start asking them some questions, like they may have some complaint, you might ask them some questions and have more of an overview of like, oh, this is connected to that they see it in a way that they've never seen it before in terms of their body and their health history.
So a really common one right now is our root canals are really, it's controversial online, especially in the holistic circles and wellness space. Root canals are controversial. And so it's very frequent. We will have someone who's coming into my office and they're worried about their root canals. So we do our normal diagnostics. We're looking at two-dimensional, at digital x-rays, and we have a 3D scan. It's called a cone beam CT. So we're able to see in a lot more detail what that root canal looks like. If all of that still looks good, then we start going into medical history. And sometimes this happens in discussion. Maybe that patient has a history of breast cancer, or their mom has a history of breast cancer. And just so happens that healthy looking root canal is on an upper molar that's connected to the breast. That's when we can have a different type of conversation. And we'll just say very clearly, maybe the root canal looks fine. I don't see any clinical signs of infection. But here's where these other connections might lie. And then the patient can decide, okay, totally fine with that. I don't feel like losing a tooth. Or a patient may decide, hey, I see that connection. I have a personal experience and that concerns me. So even though the tooth looks okay, I might elect to have that tooth removed anyway. So we're able to have kind of those nuanced conversations where our clinical diagnostics don't necessarily give us all the answers.
And so the options for if you do see infection in a root canal is the tooth is removed and they have and then what are their options after that?
After that, then we're either, you can leave it. There's no law that says that you have to replace a tooth once it's missing. But it's nice if we can, especially in some areas where you're going to miss it in terms of function, or you want to make sure that you maintain the bone in that area to help support the tooth on either side of that space. Then a lot of times we'll talk about either a removable option, like some kind of small partial denture or a bridge, or the gold standard would be a ceramic implant.
Okay. And those have the ceramic implants then have less infection potential than the root canals?
They tend to be more biocompatible. As far as infection potential compared to a root canal, I would say the implant itself is not going to get an infection, but there's still the potential for infection to happen around the implant. So it is something that we want to keep an eye on. I thought you were going to compare it to the titanium, the metal-based implants.
Do you want to say anything about that as well?
That's where the compatibility issues come up. So we see fewer compatibility issues, fewer material allergies or material rejection with the ceramic implants than we do with the metal titanium implants.
Okay. So you talked about ozone as well. I have an ozone machine that I got when I had cancer. I know a lot of people don't have home ozone machines. I'm always surprised when dentist offices don't have ozone machines. What is your take on ozone and how, it should be used in dentistry and how people might use it at home?
I love it, and I have two machines.
Can you explain what it is? I just realized so many people don't know O3. They don't know what ozone is. Yeah,
absolutely. Well, ozone, you're right. It's when an electrical charge is applied to oxygen and it goes from O2 to O3. So then there are 3 particles of oxygen clumped together in a molecule instead of just 2. And that O3 molecule is very unstable. It doesn't want to be there. The electricity kind of forced them together. And because they are unstable, then that makes the O3, it makes the ozone a very strong oxidizing agent, which helps kill bacteria, it kills fungal spores, kills viruses, and it helps wash away human dead and dying cells as well. And then the healthy cells that are in the area, it actually gives them a nice oxygen boost. And so it kind of upregulates the immune response of our healthy cells. So medically, we use it. I use it all the time in my office. We ozonate our water. It actually helps keep our water lines super, super clean. And so all of the water that comes through our dental lines, our drills, all of the machines and tools that the hygienists use all have ozone water. The ozone gas is stronger, more potent, and so we use that more directly, these more targeted approaches. So we can either inject it into the soft tissue around a tooth. We do what's called insufflation, and so we can insufflate it around gum tissue to help kill bacteria and calm inflammation around the gum tissue. We can apply it directly to a tooth itself, which can help with sensitivity. It helps the bonding onto the tooth. So lots and lots of ways that we can use it. When we're talking about root canals especially, it's super helpful because sometimes we can use ozone to help treat the inflammation in a tooth, which sometimes can help us avoid a root canal. It can take a sensitive tooth and help it calm down a little bit quicker instead of, going the wrong direction and going into an area where then they have to make that terrible decision. Do they want a root canal or do they want to lose a tooth?
Can it also be used where there is inflammation from an existing root canal or not very effectively?
It can be used. It's just that it's not going to, the root canal's there. But once a root canal's been done, it's essentially a dead tooth. It's kind of a mummified tooth because we pack the canals with some kind of inert plastic type of material. By we, I mean dentists in general. We don't perform root canals in our office. I don't anymore. Yes, it can be used, and I think it's nice to support the area, but if an old root canal is infected, like if we see infection there, then it's just going to buy you time. It's going to be a Band-Aid. You're really not going to solve the issue until you get rid of the quote unquote root cause of the infection, which is the root canal.
How do you personally use ozone? Just for it, like, do you use it at all in like every day? Like, do you use ozone water? Or ozone water is like a mouthwash, or any ways that you use it regularly?
Well, ozone water is really unstable. It doesn't last very long. So I think it's great to use, especially if you've got, I've seen some of the little personal ozone makers, the ozone machines where you can ozonate your water and drink it right away. I think those are really nice, but you would need one of the little gadgets and need it at the house in order for it to be effective. In just my daily life, I don't have oh no, that's not true. I actually do have a machine at home. I used it to, I had an old house I was trying to clean up, and it had a mildewy smell. It was out in the woods and had a bit of a mildewy smell. Checked, made sure it was safe, made sure there was no, active mold growth or anything like that. But the ozone, running it for a couple of hours, worked amazing at getting rid of that. So it can be very helpful for any like organic type of smell. You just want to make sure that you ventilate properly.
Yeah. Yeah, no joke.
You
It can really affect your lungs, right?
Yes, it can.
Okay, so in terms of people coming to the first time to a biological dentist, like one of the first things that you said that you check was like, is there the mercury amalgam fillings, and then is there any infection in root canals? And then in terms of how you look at health history, can we just go a little bit more into like, with the whole rise of autoimmune issues in women, I'm just curious like what you're seeing with your female patients and where dentistry has been able to reverse chronic inflammatory diseases or chronic inflammatory issues.
Well, I think it's partly because there's just so much more autoimmunity these days, and partly because I have my own autoimmunity story, and so that's who I tend to attract into the office are people who are like me. And so yeah, we see a lot of patients with autoimmune issues, and we just have to make sure that your mouth is as healthy as it can be. Looking primarily at inflammation. So we're primarily looking at gum health issues, making sure that the gums aren't bleeding, that there's no early signs of gum disease, periodontal disease, anything like that. But teeth can be inflamed too. Obviously, if there's some kind of hidden infection going on, that is an inflammatory process that we want to make sure we take care of. So yes, you are absolutely right. And that's one of those that's clearly established in Western medicine, even the normal guys see those connections. And so we want to make sure that we are calming that inflammation down, because inflammation in the mouth leads to inflammation systemically. So an unhealthy mouth, I have seen it correlate with flare-ups of autoimmune issues, whether that's rheumatoid arthritis or inflammatory bowel disease, any of it, and vice versa. I've seen someone who has in the past had a perfectly healthy mouth, and then all of a sudden you're like, what the heck is going on? You don't have any plaque buildup, but for whatever reason, your gums are a bloody mess today. And we start digging, and sure enough, they're having a flare of whatever their autoimmune condition is. So it goes both ways. So it's where we can, the chicken or the egg. We do our digging, we do our Sherlock Holmes detective work, and figure out kind of what those root causes are and where we need to go next.
Okay. So, one of the things that's always surprised me with dentistry is that there's not corresponding like health coaching that goes with dentistry, right? And from my background, I started yoga health coaching, which was we more or less focused on the dinacharya, or the circadian rhythm that is part of the yoga tradition. And in the yoga tradition, there's a lot of sense organ care. Right? There's tongue scraping, there's oil pulling, there's snorting various substances in through the nostrils to stimulate nitric oxide production in the sinuses, etc. And then meal spacing, intermittent fasting, longer fasting with seasonal detoxes, all of which has been, with this resurgence or the surgence of microbiome research is showing, grows the eubiotic populations and diminishes the dysbiotic populations, changing the oralome, changing the species in the sinus microbiome, et cetera. So I'm just kind of curious with like what you do based on what's going on in the oral microbiome and how you do you test for oral microbiome? Like, do you test microbiome at all?
I sure do. And we even have a health coach. So it is critically important to me. I mean, I am a health coach. I have my health coaching certification, but we have a program that we take our patients through, a 90-day accelerator program. And it is exactly that. It is seeing where their oral microbiome is when they first come to visit us, and then figuring out where we need to make shifts and changes, really getting to those root cause issues and testing and tweaking and testing and tweaking until we get them at a place that's stable and healthy and hopefully not prone to tooth decay or gum disease. That's what we strive to do. And so we have one of our hygienists will do virtual coaching visits. We bring them in a little more frequently during this period of time. And we're testing for over 700 different species of bacteria and overgrowth of candida and all the above, and seeing where we need to make those shifts. So yes, you are 100% correct, and that's exactly what's been missing in dentistry for the longest time. And I'm so thankful that we have testing now that we're able to do that.
And so can you kind of walk through like what's the test, and then are you diagnosing like with, or are you prescribing like specific species or diet or lifestyle changes or eating habit changes? I'm curious. Like, when we can just take a typical, I don't know, should we like choose an autoimmune disease like Hashimoto's or something like that to get more specific, or does it not? Is it more based on the individual?
It's totally based on the individual. So, and the saliva test, it's just a easy spit in a tube, send it to the lab kind of test. So super simple. It takes a couple of weeks for us to get it back. That's the only annoying thing, is that we got to wait to see exactly what's in there. But then there are some species that are really easy to get back into balance. And so for those cases, it may be as simple as, okay, let's do some saltwater rinses for a while. Let's do some xylitol products here or there, and maybe an oral probiotic. Like, sometimes it's just really simple, and we're just adding a few things that are easy for them to incorporate into their lifestyle anyway. And then sometimes it's not that simple. There are some strains of bacteria that are directly correlated with those other health issues, like fertility issues and different cancers and autoimmune conditions. And if we see more of those really scary pathogens, then we're going to be more aggressive and very pinpointed. Like, we want to know exactly, are these anaerobic or are they aerobic bacteria? Because then we know, is a peroxide rinse or an ozone water, is that going to be effective, giving oxygen to the area, or is that not going to be as effective? I may put people on an antimicrobial mouthwash for a couple of weeks, knowing that it will kill some of the good bacteria along with the bad. But if we've got some of the scary stuff, I may need to really aggressively knock everything down and then start building back up, seed it with the correct probiotics that I want in there. So it is very patient dependent. We're always talking about diet, always. And for diet, it depends on their gut health, how things are going. If it's a kid or an adult, because then that, obviously there are lifestyle issues. Sometimes that's easier to change than, but we absolutely want people doing good whole foods, good quality proteins, high quality fats, making sure that they're getting enough fats, because the fat soluble vitamins are the ones that are most important for tooth health, and going from there.
Yeah. So I'm curious too, for people that don't have a biological dentist in their area, like, do you recommend that they use like an online microbiome test like Viome or something like that? Or what do you suggest that they do to understand what's happening in their oralome?
So the test that I use is actually available to order online. So it's available to the public. That's not one that's gatekept to just providers only. So my favorite one right now is from Bristle. And so you can go to, I think it's bristlehealth.com or something like that. Now, your report won't be as detailed as the report that I get, but if you get that ahead of time and send the report to your dentist, especially if it's a biological dentist, then they can dig into, specific strains and figure out specific treatment protocols and that sort of thing too.
And is that, I just want, because I know people are going to ask, is this the Bristle oral microbiome test? So it looks like
Yes,
it's like $170 online.
that is probably correct. Yeah.
Okay, awesome. That's great to know. Now, one product that actually I want to ask you about, two products. One is actually a product, the other is just, I think, a substance. So Revitin has a prebiotic toothpaste that has vitamin C, D, E, K, ionic minerals, and CoQ10. I notice a huge difference when I use it. And otherwise, I can have very sensitive gums. But I've noticed when I use Revitin that my mouth, like more so than like any other factor that I've ever found, is like using that toothpaste makes a huge difference.
I love it.
Are you familiar with it at all, or do you have
I
an
am.
that's
Yeah,
yeah.
I think it does a good job. And like you, the patients that I have that use it, they love it. So I don't have any negative comments to say about it. I think, and they're nice, clean ingredients. So I think they're supportive of tooth health, supportive of gum health. So yes, stamp of approval.
Okay, awesome. The second thing I wanted to ask you about is methylene blue. I mean, I think I got triggered when you were saying about breast cancer, because I think there are some holistic communities, and I'm not sure the research on it, but gargling with methylene blue, how it clears the tonsils and how the tonsils are a lymphatic drain for the breast tissue. So some correlation with people that have either breast cancer or have a genetic marker for breast cancer can benefit through gargling or just cleaning their mouth with methylene blue. And I'm curious where, I mean, obviously it turns your tongue blue for a hot minute, not too long, but yeah, methylene blue, go for it.
And I think the jury's still out. It's still early to tell how it would directly impact oral health. I've got lots and lots of patients who use it. I would say I have not noticed any negative oral health effects. Haven't noticed a ton of super like just shockingly positive oral health effects either. So, but usually that's not why patients are using it. Usually they're using it for other reasons, other health reasons besides just their oral health. So I haven't noticed huge differences. I would just say I can tell you after seeing many cases that it doesn't just stain your tongue, it also stains your fillings. So white fillings, anything with a scratch or a scuff in it or a crack or an edge, it's going to really absorb that blue really nicely. I've had to work hard trying to buff that stuff out.
Interesting. Yeah. Yeah. And it'll turn your pea green because blue plus
Oh, that
yellow,
makes sense. Yeah.
green.
It's a fun little experiment.
Yeah, yeah. So let's talk a little bit about breathing and what's happening. I mean, one of the things that I have seen just with, I think, the increase in, when I don't want to say childhood obesity necessarily, but like kids are heavier, kids are overweight. Often when we're overweight, the ostia between the nostrils and the sinus microbiome is blocked, or the sinuses gets blocked, and then it creates deformities in the mouth. In Ayurveda, which is my background, there's just like there's these basic like baby care, like little tips and tricks. And like one of it is like for the mouth, if the baby is sleeping and the mouth is open, like you close the mouth. And so that it starts to adjust. And I notice these things are just not really that well known in modern parenting, despite obviously information being accessible and free for most people. So I'd love for you to hear just like or you to talk about like cases that you've reversed of like lifelong mouth breathers or chronic mouth breathers or children that are mouth breathers, and what you notice right off the bat when you're looking at a mouth, whether or not you can tell if the person's a mouth breather. Just go for it on mouth breathing versus nasal breathing.
Well, I won't go for it because we'll be here all day. But yeah, and I do the same thing with parents. I will tell them the exact same thing. If you see them, if you know that they are able to breathe through their nose, if they're not stuffy or anything, and if you see them mouth breathing at night, then if you can just guide their jaw closed, kind of hold their lips closed for a second, see if you can build that habit of nose breathing, because our nose is meant to be our primary source of respiration. Our mouth is really only meant to be the backup system. I know you talked about nitric oxide a little bit, all the nitric oxide that's produced in the nose. If you're breathing through your mouth and you're not getting those same benefits of nasal breathing, it also really, really messes with your microbiome. It dries out the saliva and then makes your whole mouth more acidic. So it makes things more inflamed, which makes you more susceptible to tooth decay, more susceptible to gum disease. But then beyond that, there are serious growth and development consequences in our children. And so absolutely, I can tell when I look at a child, if they've been mouth breathing for several years, because their entire face changes. They get much longer growth in the lower face. So they get kind of this constant like mouth open type of look. Yeah. They start getting the venous pooling under their eyes. So they have dark circles under their eyes. They tend to have a more recessive chin. So a chin that is not as prominent, which means their mouth is not growing as wide and large as it should be. So there's less room for the teeth. So the teeth are more crowded. So it's so important that we start as young as possible to catch these things, because we really can help set them up for a lifetime of success and a lifetime of nasal breathing and room for their teeth, and no need to think about pulling wisdom teeth because they've got a nice wide jaw that has room for all of their teeth. Also sets them up for success in sleep and breathing later in life, in adulthood. Because like you said, if you're breathing through your nose the way that you should, and your jaw is developing, your airway is developing the way that you should, then you're less likely to have some of these issues with deviated septum, with inflamed turbinates, like inflamed soft tissue in the sinuses, and a lot of these things that can lead to sleep apnea and poor breathing when you sleep. So just tons and tons of effects if we can catch it early. And some of the root causes could be like this is where we get into tongue tie issues. And again, that could be another hour-long discussion, because we still don't 100% know why we're seeing so many more tongue ties now than we did 20 or 30 years ago. But even the midwives that I work with, the midwives who have been practicing for 30 plus years, they all say it's not just an increase in awareness. They're saying, I literally see more tongue ties now than I used to.
Sorry, will you define tongue ties and what are
A tongue tie could potentially be the root cause of all of these mouth breathing and airway issues downstream. So the tongue, the lingual frenum, is just that piece of tissue, the little string of tissue that attaches your tongue to the floor of your mouth. And for some people, that's much more prominent than in others. You should be able to open your mouth wide and lift your tongue all the way to the roof of your mouth without the floor of your mouth having to compensate. If you can't, then you may be a bit tongue-tied. And then we see some as severe as they can't lift their tongue at all. Like that string of tissue goes all the way to the tip of their tongue. If we catch it early, then we can correct it early as during the newborn phase. But a lot of times it's showing up as an issue with breastfeeding. But if it's not, if a baby and a mama are both able to compensate really well, then sometimes we don't catch it until later on in childhood. So the earlier we can catch it, the better. The older we get, the tougher it gets to make these corrections. So in newborns, it could be as easy as doing a little laser frenectomy procedure, which is super quick, super easy. We've got our protocols for doing that more holistically too. In childhood, if we wait longer, we may still need to do the frenectomy, but then we may need to guide the kiddo's growth and development. So they may need some kind of expander or some myofunctional therapy or combination of all of those to help guide the growth of their mouth wider. And then if it waits even longer, and if now we're into late teens and into adulthood, then we may not be able to get any movement, you could still do a frenectomy if it's appropriate then. I think it's less often that it's appropriate choice as an adult. But our options just get more narrowed, our options get tougher, our options get more expensive and more of a annoyance, really, just in time and effort on your part.
Yeah. So in terms of people like looking for a biological dentist and trying to find one in their area, so you're in the Dallas area, okay? Everyone can look for Dr. Toni Engram if you're in the Dallas area. But for people that are outside of the Dallas area, like is there a database? How do they look? And then how do they know? Because I know like where I am, there's like a little bit of regionalism, and the more traditional dentists are really they're less friendly towards the biological dentists.
Really?
Yeah, but I'm in Idaho, so whatever. Yeah, I'm just kind of curious, like as people are navigating this, because they might ask their existing dentist, like, why aren't you doing this? And there's obviously you went into the beginning and like a load of reasons, including how just the entire back end financial structure of the practice is run that might be disincentivizing for traditional dentists to make the switch, et cetera. So how do people navigate this, and how do they find someone that might meet more of their holistic emerging needs than just their past needs?
Yeah. So we have a lot of patients that drive in and fly in. So we're happy to see you if you want to make a trip to Dallas. We've got lots of people who do travel, and then we can always give you tips and tricks on, if you want to get the big stuff done with us or the surgical stuff done with us, and then we send you back in good shape to your more traditional dentist if that's what needs to happen. There's also, I think probably the biggest directory is going to be with the largest organization that does our continuing education. So it's IAOMT.org, and that's just a really painfully long acronym. It's the International Academy of Oral Medicine and Toxicology, but they do have the largest database, and it even divides the members up into those who are accredited, those who have their fellowship, those who are trained in safe amalgam removal, and those who aren't. I think it even still says how many meetings the dentist has been to, so if they're like all in it and they do all the things, or if they are just dipping their toe in and they've only been to one of the conferences. So I think that's the most robust directory, but absolutely search us out, and we're happy to help you any way we can.
Okay, awesome. Great. And then in terms of, let's go back to fluoride, I know there's a lot of studies on fluoride and enamel and protection, and where is IAOMT, as an organization with fluoride across, is there any blanket statements across the board, or is it more nuanced?
I think the blanket statement is 100% of biological dentists, and even some of the mainstream dentists, think that fluoride does not belong in our water. It doesn't belong in our water. Now, is it useful in toothpaste and in dental products? That's where it gets more nuanced. And I have plenty of colleagues who kind of ride the fence on that and say, they don't mind the topical applications of fluoride. I personally don't have it anywhere in my office. It's not in any of our products. It's not in our water. We filter it out from the minute it comes into the building. So I've taken a hard stand, but I can tell you that if it was not in our water, I would probably ease up a little bit. If it wasn't in our water, and if we could have a good idea of the actual dose and what dose is shown to be beneficial versus a higher increased risk of side effects, then I would feel better about the topical use of it. But as it stands right now, we can't control how much we're getting because it's everywhere. And when it's in the water, it's in everything. You think you're growing your own plants in your garden and you're avoiding it, great, but you're using a water hose to water your plants with. Unless you're filtering your water hose, then you're still getting fluoride in the vegetables you grow in your own garden. If you buy a bottle of green tea at the store, then if it's using a municipal water source, then it's got fluoride in it. You just can't get away from it, and it's impossible to measure how much you're actually getting. So until that stops, then my stance is a hard one. Let's avoid it wherever possible.
And what Will you just tell people in terms of like what are the dangers of fluoride and how did it get in our water in the first place? A little bit of background.
The risks were really underappreciated for a long time. We're just now recently starting to see a few more studies pop up here and there that are showing, oh no, there actually is a verifiable risk. Fluoride will compete with iodine in the thyroid. So my functional medicine doctors that refer patients to me, they really don't want their patients using any kind of fluoride if they've got any kind of thyroid issue or potential thyroid issue. It can calcify the pineal gland. And the biggest one that upsets me is its correlation with decreased IQ in children. And it's in multiple studies now.
And in terms of people, who is it more or less like water filtering and being more aware of what's in their, what their food sources are?
You can check to see if your water system has fluoride added to it or if it contains fluoride. Most of them in the US do, but not all. So you can always look up EWG and check your water. A lot of times you can check your water by zip code to see exactly what's in there, what contaminants are in there most often. But the way to filter it out most reliably is with a reverse osmosis filter. So again, additional risk with that is if you're using, that's great. If you're filtering out the fluoride, you're filtering out hopefully some pharmaceuticals with reverse osmosis filtration, but you're also filtering out minerals. So you want to make sure to add some trace minerals back into your water if you're doing reverse osmosis filtration. And it's not, you were asking how did it get there in the first place? It's because back in the olden days, like World War II era, they found it naturally occurring in some communities, and fluoride can be naturally occurring in places, and they noticed that those places had lower rates of tooth decay. So it is a useful tool and is correlated with lower rates of tooth decay, but the kind that they add to water where it's not naturally occurring, that's added to water is not the same. It's a byproduct of fertilizer waste. So it's more of a manufactured product. It's highly, highly caustic, very, very acidic. And so there's nothing natural about the fluoride that's added to the tap water.
Well, Dr. Toni, thank you so much for a good overview of biological dentistry and what's going on. For those who missed it, Dr. Toni's website is flourishdental.com, and you can find her on Insta at Dr. Toni Engram, TONIENGRAM. Any closing thoughts?
Just encourage everyone. I'm sometimes as a dentist, I'm a Debbie Downer, but I would say, so I want to leave your audience with a message of encouragement and say your bodies are designed to heal. You just need to give them what they need. So be encouraged, take heart. It's not all doom and gloom.
Yay. Yeah, there's so much we can do. Oh my goodness, right? There's so much. Yeah. And for those in Primal Habits, there's chapters on the oral microbiome and snort and swish. So please read those chapters if you want more of my take on primal habits and oral microbiome. Yay, Dr. Toni, thanks so much.
Awesome. Thank you so much. I appreciate it.